In spite of what many doctors believe, progesterone is a crucial hormone for women at every point of their reproductive lifespan, from young women through perimenopause and even in menopause. But women can experience some side effects with progesterone. In this video, we're going to go over progesterone side effects, both the mild and manageable ones, but also some others that can be a much bigger, more serious problem. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources, mostly about hormones and hormone optimization. I just watched a YouTube video from a well-known menopause doctor. She was just recently on Oprah in the last few weeks. She calls progesterone snake oil. This doctor says progesterone is not that useful. Well, that's a commonly held belief among a lot of doctors and healthcare practitioners, and I couldn't disagree more strongly. That's completely wrong. Progesterone is essential for protecting the uterus, if you're taking estradiol especially. But even if you've had a hysterectomy and you don't have a uterus, progesterone is still essential. When you go into menopause, your progesterone level is basically going to be 0. For many women, that means you're going to stop sleeping. And by that, I mean stop entirely. I've heard from literally hundreds of menopausal women who tell me they sleep maybe 2 or 3 hours every single night for months. A woman I'll call Jean emailed me a while back to say, I only sleep 3 or 4 hours a night. Constantly tired, no energy ever. It takes everything I have to make it through each day. Poor concentration, hard to stay focused, depression, mood swings. I've had these issues for about 6 years. Well, I find myself getting frustrated when I can only get maybe 6 hours of sleep, and I think of that as insomnia. But 3 or 4 hours every single night for 6 years? I can't even imagine having that degree of insomnia. Progesterone, specifically oral micronized progesterone, is the single most effective treatment for menopause insomnia, period. For the vast majority of menopausal women, progesterone is the solution to menopausal insomnia. Women sleep way better on progesterone, and they tell me their lives are basically 100% improved. There are side effects with progesterone, including acid reflux or heartburn, upset stomach, nausea that can sometimes even develop into vomiting. Those side effects that are GI side effects are probably the result of some of the valves. They're called sphincters up and down the GI tract that sort of loosen up and cause that nausea or acid reflux. Other progesterone side effects include drowsiness, but that's sometimes a desired effect for women who basically never sleep. It's usually not an issue if you take progesterone at bedtime. Dizziness, vaginal bleeding is very common and could indicate your progesterone or your estradiol dose needs to be changed. Vaginal bleeding tends to sort of settle out after a few weeks or months. Bloating and water retention are common with progesterone. Breast and nipple tenderness can happen. Headaches can be more frequent. Most of these side effects are things that women can tolerate and they can get used to, or they may eventually even go away. But there's a small percentage of women who have severe, even extreme reactions to progesterone. I had a conversation a couple weeks ago with a good friend of mine and my wife's. As soon as she started taking progesterone, she had extreme anxiety, mood swings, irritability, anger, and what she described as suicidal depression. Severe progesterone intolerance is something that I've heard about from a few women who email me or comment on my videos. I sent an email out to about 500 hormone providers that I know, asking them what their experience with severe progesterone intolerance was. Several of them said that it was very rare, but also very real. Our friend mentioned to me that this reminded her of when she was younger and she'd experienced something called PMDD. That's shorthand for premenstrual dysphoric disorder. It's kind of like PMS or premenstrual syndrome, only it's 10 times worse. For the last 10 days of her cycle every month, she'd become crazed, angry, anxious, and so depressed that she wanted to end her life. She literally felt sorry for her husband having to live with her. Well, I wondered if there was a connection between PMDD and progesterone intolerance, beside the fact that our friend seemed to have both. So I did some research into the medical literature. There's not a whole lot of information about progesterone intolerance in menopausal women, but there are several studies about PMDD. It looks like there's a relationship between PMDD and something called a GABA-A receptor. A little backstory here. Progesterone is metabolized or broken down by the liver. One of the metabolites or results of that process is called allopregnanolone. Now, allopregnanolone fits sort of like a key in a lock into those GABA-A receptors. Usually, the action of allopregnanolone, when it clicks into that GABA receptor, is to tell your brain to relax and get some sleep. Allopregnanolone and its action on GABA receptors is the real reason why progesterone helps women sleep. But some women have GABA receptors that, for some reason, don't really like allopregnanolone. Those women get more allopregnanolone in the last 10 days of their cycle because that's how it works. They have more progesterone and it becomes allopregnanolone. But that extra allopregnanolone doesn't make them feel relaxed and sleep well. Instead, it makes them anxious, irritable, angry, and suicidally depressed. So as I mentioned, there's not a lot of evidence for that happening in menopause, at least not published in the literature, but it certainly makes some sense that that might be what's happening in women who have an extreme progesterone intolerance. The bottom line about progesterone side effects is that the vast majority of women don't find them to be that bad. They deal with them and usually find they go away or just accommodate to them. But a small percentage of patients, possibly those who had PMDD when they were younger, have severe reactions that really require the intervention of a hormone optimization specialist. Your hormone optimization specialist will work with you to decide the best course of action in your particular case. If you're in menopause, I'd love to learn more about your personal experience. Are you struggling with insomnia and nothing seems to work? Have you tried progesterone and found it to be a miracle solution to your sleep problems? Maybe you're one of those women who have a severe reaction to progesterone. I'd love to learn more about your experience. I'd love to know if you've had both PMDD and a progesterone intolerance. If you're interested in the idea of using hormone replacement therapy or HRT for your menopause, but you're a little confused or a little nervous about it, not sure if it's right for you, well, I have something that can really help. My brand new course, The Menopause Solution, helps you find the clarity and confidence to make your HRT decision. You can go through the material in the course in about 2 hours. Click the link that says The Menopause Solution to learn more about the course. If this video has been helpful at all, click the like and subscribe buttons, and then ring that little bell to get notified anytime I post a new video. Thanks so much for watching, and I'll look forward to talking to you again soon.